Welcome to the deep dive. We're here to plunge into complex topics and, well, pull out the key insights for you fast.
That's the plan.
Today we're tackling something called pubalgia. You might have heard of it. It often gets tagged as just an athlete's issue.
Right. And one that feels, almost impossible to shake off sometimes. People worry about surgery.
Exactly,
Okay.
that ghost of surgery. But what really grabbed me from the sources we looked at was this very direct statement. With a good treatment, you can be cured. That feels hopeful.
It is hopeful. And that's our mission today, really, to unpack Pubalgia. It is complex, no doubt.
So we'll dig into why it's so tricky.
Yeah, why it's challenging. The body mechanics involved, which are pretty intricate and, crucially, lay out the specific effective ways to treat it based on these sources.
Basically giving you a shortcut to getting properly informed beyond the usual myths.
Exactly. Straight to what works.
Okay, let's dive in. Where do we start? What actually is pubalgia, according to this research? It feels like a term that gets thrown around a bit loosely.
That's a great starting point.
Yeah.
So the sources call it dynamic osteopathy of the pubis. Bit of a mouthful, I know.
Yeah, just a bit.
But essentially, it's an issue involving the pubic bone and all the structures connected to it. And yes, while you see it a lot in athletes, it's really important to know it's not just them. It can happen from, say, a bad movement, pushing yourself too hard, or even just getting a direct blow to the area.
So you could get it moving furniture, theoretically.
Absolutely. You definitely don't need to be scoring goals or running marathons.
Got it. Now, you mentioned the pubis is central, but the sources talk about the whole pelvis being like super complex articular machinery. What does that mean in practice?
Right. Think of your pelvis as this central command hub for movement. The pubis, or the pubic symphysis, is that joint right at the front, connecting the lower bits of the pelvis.
Okay.
And it's not fused solid. It's actually a cartilage bridge, and it gives us quite a bit of mobility, which you need for walking, running, just moving around.
But it's not working in isolation.
Not at all. That's the machinery part. It's connected to the sacroiliac joints at the back.
Yeah.
That's where your sacrum meets your hip bones,
Uh-huh.
and the lumbosacral joint, connecting your lower spine to the pelvis. Plus, of course, your hips, where your legs join in.
Wow, okay, so it's this whole interconnected network down there.
Precisely. A super complex system where everything has to work together smoothly.
Which brings us to the muscles holding it all together, right? The sources break this down quite a bit. It's not just one muscle group causing trouble.
No, definitely not. The research points to 4 key muscle components that, if they fail, can set off pubalgia.
Okay, what are they?
You've got muscles in your lower limbs, think hamstrings, adductors, those inner thigh muscles. Then the mid-body muscles, your abs, your spinal muscles, the core stuff.
Right.
Then you have muscles on the front of your body,
Okay.
the anterior ones, and muscles on the back, the posterior ones.
So legs, core, front, back, pretty much everything connecting to the pelvis.
Essentially, yes. All these groups, plus lots of smaller specific pelvic muscles and ligaments, they're all meant to be in, the sources say, tension but harmony.
Tension but harmony. I like that. What does it mean?
It means they're all pulling and working, but in a balanced way. Constantly adjusting and compensating to give you smooth movement power. Especially vital for athletes, but really for everyone. That harmony keeps things moving without pain.
Okay, so it's a finely tuned system, but what happens when that harmony, well, breaks? There was a strong analogy used.
Yeah, a really vivid one. The sources say when just one of these components fails, the whole thing collapses like a great house of cards.
Wow.
It really drives home the complexity, doesn't it? It's rarely just one simple thing. It's more like a domino effect or, house of cards collapsing because one card was out of place.
That explains why it can be so hard to figure out and treat effectively.
Exactly. Finding that first card, the real root cause, is the challenge.
So given all that complexity, that house of cards situation, I guess finding the exact problem is paramount. The sources seem to stress diagnosis even more for pubalgia.
You've absolutely nailed it. Because of that potential cascade effect, getting the diagnosis right isn't just important, it's, well, everything.
More so than other injuries, maybe.
The sources argue yes. More important still, in pubalgia, they say correct and precise diagnosis is the key for any body issue. But here, with so many potential contributing factors.
You really need to know exactly where to focus.
Precisely. You need thorough evaluations, specific tests, to pinpoint where the problem is. Otherwise, your treatment is just guesswork. You can't fix it if you don't truly know what's broken, or rather, what started the collapse.
Okay, so let's talk about those triggers, the whys. What typically causes this harmony to break down and the house of cards to tumble?
Well, a big one is that loss of muscular harmony we talked about, that balance, that tension with harmony. It can get disrupted. Could be muscle shortening, maybe one group gets too tight, or muscle distension, maybe something gets overstretched or weak, or it could be a specific bad sports gesture, an awkward movement during activity.
And when that happens, compensation kicks in.
Exactly. Your body tries to pick up the slack elsewhere, but that compensation puts strain on other areas, leading to things like tendinosis, tendinitis, or enthesitis.
Enthesitis.
Yeah, that's inflammation, right, where the tendon attaches to the bone. Often happens because that point is being overloaded due to compensation somewhere else.
It's amazing how the body tries to adapt, but sometimes that adaptation causes its own problems. What else can go wrong, besides the muscles? What about the structures themselves?
Good point. The sources also highlight issues with the cartilage in the pubic symphysis itself.
That cartilage bridge you mentioned earlier.
That's the one. It can get injured, torn, worn down over time. Sometimes it can even calcify, get hardened. Yeah. And when that happens, the pelvis just can't function properly. That adds another layer of dysfunction and usually quite a bit of pain. Makes simple movements really difficult.
And I guess any part of that super complex machinery jamming up could cause issues too, the joints themselves?
Absolutely. Articular blockages are another major cause. Any of those key joints, the sacroiliac, the pubis itself, the lumbosacral connection to the spine, even the hips, if one of them gets blocked or functions badly, it throws the whole system off.
So it could be a joint that's stuck.
It could be. Or maybe it's moving incorrectly. Either way, it contributes to the overall imbalance and can show up as pubalgia. And then, of course, there are the more direct triggers.
Right. You mentioned those.
Yeah, a bad sports movement, an actual trauma, like a fall or a blow, or just a really bad effort, like lifting something too heavy the wrong way. Those could be immediate causes, too. So it could build slowly or happen suddenly.
Okay, well, it's a lot of potential causes. But the good news, as we started with, is that it is treatable with the right approach. Let's get into that. The sources mention chiropractic and osteopathy. How do they help?
So chiropractic, according to the sources, really focuses on the joints, restoring that articular quality and harmony.
Getting the machinery moving right again.
Exactly. It uses techniques like high-speed manipulations, those quick adjustments, or sometimes deep and progressive movements to unblock or improve the function of those joints that aren't working properly. Super important for the pelvis, given all its connections.
Okay, that handles the joint mechanics. What about osteopathy? The sources said it restores musculoskeletal ligament quality.
Right. Osteopathy works alongside chiropractic. If chiropractic is focused on the joint alignment and movement, osteopathy zooms in more on the soft tissues, the muscles, ligaments.
Dealing with those compensations.
Precisely. It aims to find that problem muscle, the one that's tight or weak or just generally compensating, and works to restore its normal function, its quality. So you're tackling both the skeletal side and the soft tissue side.
Got it. Both are needed. Now, this next part sounds really crucial. The sources highlighted a very common mistake in treatment, something that almost guarantees it won't work long term. This feels like the key insight.
It absolutely is. This is where things get, as the source puts it, really interesting for anyone dealing with this.
Okay, lay it on us. What's the big mistake?
The mistake is to target the treatment in the first instance on the point of pain.
Wait, so don't treat where it hurts first. That sounds completely backward.
It does, doesn't it? But think back to the house of cards. The sources are clear. The problem is not there, the pain you feel. That's usually the result of the compensation, not the cause of the imbalance.
Ah, okay, so you're just creating a symptom.
Exactly. And if you make that mistake, if you only chase the pain, the treatment will fail. You might feel better for a bit, but the source says the pain will recur in maybe 15, 20 days. Because that underlying imbalance, the thing that collapsed the cards, is still there.
Wow, okay, that's huge. So if treating the pain point first is wrong, what is the right way? The sources outlined a specific sequence, right?
Yes, a very precise two-stage process. Stage one, you first have to restore biomechanical harmony to the entire pelvis or the entire body.
Using that chiropractic and osteopathy we talked about.
Correct. You need to fix the overall alignment, the joint function, the muscle balance first. Rebuild the foundation, essentially. Address the root cause of the collapse.
And then?
Only then, once that overall harmony is back, do you move to stage two, working on the specific point of pain.
Okay, and how do you work on that specific point once the foundation is solid? The sources mention things like electrolysis or high-potency classes. What are those?
Right. So, without getting super technical, electrolysis in this context usually involves using a very fine needle and a small electrical current. It helps to stimulate healing right at the site of chronic tendon or ligament damage, breaking down scar tissue or those calcifications we mentioned.
Okay, like kickstarting the local repair process.
Sort of, yeah. And high-potency classes generally refers to advanced, highly specific physical therapy exercises and rehab protocols. These are designed to really target the injured tissue,
To do what exactly?
to improve the quality of the collagen there, make it more elastic, get rid of any leftover calcifications, and just generally restore the specific functions, strength, flexibility, control to that particular ligament, muscle, or tendon that was causing the pain symptom.
So it's targeted repair work.
Exactly. It's essential, but it only truly works and lasts if you've done stage 1 first, if you've fixed the underlying biomechanics. The order is everything. That's the difference between just managing symptoms and actually achieving a cure.
That makes so much sense now. So the big takeaway here is that pubalgia, while definitely complex, complicated, often misunderstood, it is treatable. It can be cured.
Yes, the sources are quite clear on that.
But it requires this strategic whole-body approach. You absolutely have to restore that overall biomechanical harmony before zoning in on the spot that hurts. You need to see the bigger picture.
It really highlights how interconnected everything is, doesn't it? Which leads to maybe a final thought for you, listening. Given how linked up our body's machinery is, and how just one little thing being off can ripple outwards and cause significant pain somewhere else entirely, what other, maybe seemingly random symptoms might you be experiencing? Could they be clues? Clues to some deeper underlying imbalance in your own body's incredibly complex system that maybe you haven't considered. Something to think about.